Hello everyone, my name is JR. I'm here to present to you guys about health promotion for African Americans who are affected by congestive heart failure. The problem is there are high incidences of readmissions for patients who are affected by congestive heart failure. Researchers have found that African Americans have a much higher incidence of heart failure than other races. Before age 50, African Americans' heart failure rate is 20 times higher. Contributing factors to hospital readmission include disease centered, which is secondary to the progression of an underlying cardiovascular disease such as coronary artery disease or valvular disorders. Physician-centered, which involves risk management, early detection, and treatment of comorbidities and proper treatments for the CHF. Patient-centered include poor compliance with fluid restrictions, medical dietary regimens, poor follow-up after discharge, and poor understanding of the disease. Community resource, there's a lack of social support, lack of available resources or follow-up or home services. And for Millennium Goals, I found out that it supports universal primary education and combat this major disease. Learning need assessment. We need to assess if they understand the disease, that it may be including the anatomy and physiology. Do they understand risk factors? Do they understand medication compliance? Or do they understand dietary regimen related to the disease? Do they understand the importance of taking on vital signs and signs of worsening symptoms? Therefore, we should incorporate self-management of symptoms, drug counseling, rest and exercise, restriction of sodium intake, restriction of fluid intake in severe heart failure, avoid alcohol intake, smoking cessation, reduce overweight, and the importance of vaccinations such as pneumococcal and influenza immunization. The health promotion model I chose is Proceed framework. It is used in public health, not just for the health intervention, but for community intervention. It focuses on the community. It focuses on health maintenance, shifting from the treatment of the disease to the prevention of other heart conditions that may be related to CHF. Active promotion behaviors and attitudes include proper diet, exercise, reduction of stress. It also provides a structure to develop a coherent plan that addresses the necessary issues. It also provides guidelines in regards for the assessment, planning, implementing, and evaluating community intervention. And it provides accurate information about the issues in the question and about the history and background in the community. It considers administrative and policy guidelines that can shape an intervention, such as core measure about CHF in the hospital. Health Promotion Educational Plan. The goal is the group of African American will understand the condition of CHF, risk factors related to the disease, and know what kind of treatments are available to improve the quality of life and prolong lifespan. Therefore, it will help decrease the readmission in the hospital. The outcomes, they will be able to verbalize the disease process of CHF and the risk factors that may contribute to the condition. They will be able to verbalize what kind of treatments and resources are available. They will be able to verbalize the importance of medication compliance, monitoring of current condition, and dietary regimen, and the necessity of lifestyle changes. I will use teach back method. Instead of just telling people to eat a low salt diet and weigh daily, education focuses on what salt does to their heart and why they ask to weigh daily. When patients understand that eating chips cause water retention, which makes their heart work hard, they can better understand how to change behavior. And we need to explain to the patient about the disease process of heart failure, review the steps of weighing them daily, such as where scale must be on hard surfaces, the importance of resting between activity, discussion about limiting fluid intake to 2 liters and sodium intake to 2 grams each day. Review medications such as diuretics, ACE inhibitors, beta blocker, including side effects to, and avoid medications such as NSAIDs, antacids, and decongestants. And the importance of follow-up with doctors after discharge. You should also incorporate how to cope with smoking, such as distraction, including washing your car, draw, do a puzzle, deep breathing, and get support such as counseling. Try yoga for stress, sleep better, get fit, and quit smoking. And there are research and evidence that I found regarding this issue. Um, African Americans, it occurs at early age, and it's worse at the time of diagnosis. Hypertension is the co-founding factor. Obesity is linked to hypertension and complex for cardiovascular disease. Effective treatment combination of ACE inhibitors and beta blockers are the most effective treatment of choice for this group of people. Other risk factors associated with CHF include coronary heart disease, diabetes, AFib, male gender, ethnicity, such as Black ethnicity, lower education, smoking, alcohol consumption, not participating in regular physical activity. And there's an article that says that massage reduces pain, blood pressure, heart rate, cortisol, and promotes sleep and immune function, which improves patient's condition. And we should also incorporate stress management programs for these people. To evaluate if they learn something from what I taught them. I choose multiple choice questionnaires to measure the level of knowledge. We can also use the Bloom's taxonomy that I found online, which include recalling information, comprehending what was taught, applying the concept through teach-back method, analyze, and evaluation. There's a tool that I also found online, which is called Questionnaire about Heart Failure Patients' Knowledge of Disease, which consists of 19 questions and is scientifically appropriate and includes like what is the disease about, and growth factors, signs and symptoms, and possible side effects, and more. Um, African Americans, conclusion, African Americans is at higher risk for readmission in regards of comorbidities that may include in the diagnosis of CHF. Therefore, it is important for them with heart failure to be educated in order to adapt to their chronic condition and perform self-care behavior. Education is an important component in heart failure care and should be provided through effective and well-evaluated strategies. There are studies that show that many of the hospitalizations are inappropriate, avoidable, or related to conditions that can be treated outside the hospital setting. This includes the proper treatment of heart failure. We also need to consider about the financial implications of hospital admissions related to CHF because treatments can cost billions of dollars. We need to provide this group of people about resources that may be available in the community that involve routine follow-ups and group therapy for people who are affected with the same condition. And also, we can provide them referrals, pamphlets, posters, etc., whatever they prefer and whatever we can provide them. And this concludes my PowerPoint and my presentation. And these are my resources, 6 resources. Thank you.